Today, I'm going to present my research about the anti-inflammatory, antioxidant, and neuroprotective effects of niacin in mild traumatic brain injury in rats. I'm from Turkey, and traumatic brain injury is a defined an alteration in brain function or other evidence of brain pathology caused by an external force. The effects of traumatic brain injury are divided into mainly primary and secondary injury. The primary injury is the mechanical damage that develops at the time of trauma. It is inevitable and occurs directly in the neurovascular structures and glial cells. So the only thing that we can cope with the primary injury is avoiding the brain injury, avoiding the brain trauma. And the injury mechanism that we can modulate pharmacologically or with other treatment modalities are the secondary injury mechanisms that we are looking mainly is the neuroinflammation. And neuroinflammation is divided into two, the microglial activation and astrogliosis. And microglial activation just induce inflammatory cytokines and also leukocyte infiltration. And they all combine the injury mechanism. So the exotoxicity, mechanical metabolic disturbances, apoptosis, ischemia, oxidative stress, and blood-brain disruption are the other pathophysiological mechanisms that plays key role in the traumatic brain injury. And what is niacin? Niacin, or in other names, nicotinic acid or vitamin B3, is a water-soluble vitamin. Its neuroprotective activity was well known for ischemic stroke, Alzheimer's disease, and Parkinson's disease. And in neurodegenerative diseases, it's all studied. For traumatic brain injury, as we know from the previous slide, that traumatic brain injury induce inflammatory cascades, microglial activation, and energy deprivation increases oxidative stress. And when we look at the niacin's effects, it decreases microglial activation and modulates inflammatory and immune genes and increases neurotrophic factors, decreases DNA damage, decreases oxidative stress, increases ATP content, decreases misfolded protein toxicity, and restores mitochondrial functions, increases mitochondrial biogenesis. And as we look at the effects of niacin, it well fits with the neuroinflammation and toxicity cascades that induces by the traumatic brain injury. And in this study, the possible neuroprotective effects of niacin against mild traumatic brain injury were investigated with various parameters. It is thought that the administration of niacin after mild traumatic brain injury will show neuroprotective activity by reducing inflammation, oxidative stress, apoptosis, and will have a positive impact on corticospinal functions and learning. And what was our methods? Visceral albino male rats were grouped as control, traumatic brain injury, and niacin treatment groups. Under general anesthesia with ketamine and kecilazine, traumatic brain injury was induced by dropping a metal 300-gram weight from a height of 1 meter on the skull. So before and 24 hours after trauma, neurological examination, tail suspension test, Y-maze test, novel object recognition tests were all performed. 24 hours after TBI, the rats were decapitated, and biochemical and histological evaluations were performed afterwards. Our data were analyzed using GraphPad Prism 8 and expressed, our data was expressed as a mean, plus, and minus standard error of mean. And values of below 0.05 were considered to be statistically significant. When we look at our results, first one we are looking are the luminol and lucigenin enhanced chemiluminescence levels. And when we look at the pathophysiological importance of this chemiluminescence and acute inflammation, the neutrophil, increases in the damaged tissue. And the luminol is the direct measurement of the myeloperoxidase activity, which shows the neutrophil infiltration and activation in the tissue. And for lucigenin shows the macrophage activation. So when we look at our results, in the trauma groups, as you can see, luminol and lucigenin enhanced chemiluminescence levels were increased, which were reversed with niacin treatment, and these comparisons were statistically significant. And we can conclude that it has been shown that niacin treatment reduced the increased luminol and lucigenin enhanced chemiluminescence, and these results indicated antioxidant and anti-inflammatory effect of these treatments. When we look at the inflammatory cytokines, interleukin-1 beta, interleukin-6, tumor necrosis factor, interleukin-10, transforming growth factor beta, caspase-3 and cleaved caspase-3 levels were measured with ELISA method in the brain tissue. When we evaluated the inflammatory cytokines, an increasing trend was observed in the trauma groups, but there was no statistical significance. And there was also a decreasing trend in niacin groups. And when we look at the interleukin-10, a significant increase in interleukin-10 levels was observed in the niacin treatment groups when compared to the trauma, and these differences were statistically significant. And we can conclude that niacin is an anti-inflammatory agent and shows this anti-inflammatory activity via interleukin-10 modulation. When we look at the caspase-3 and cleaved caspase-3 activities, the caspase family is a cysteine proteases that regulate many steps of programmed cell death. Cleaved caspase-3 is the active form of caspase-3. And when we evaluated the caspases, an increasing trend was observed in the trauma group, and there was also a decreasing trend in the niacin group, but there was no statistical significance. And in this study, brain injury was graded histopathologically following hematoxylin and eosin staining. And we evaluated the cortex, hippocampus CA3 region, and hippocampus dentate gyrus regions. And we all show that trauma-induced histopathological damage in cortex, hippocampus CA3 region, and hippocampus dentate gyrus statistically significant. In the niacin treatment groups, in the cortex and the hippocampus dentate gyrus shows amelioration in these tissues significantly. And also there was a decreasing score in the hippocampus CA3 region, but it wasn't. This shows that niacin is neuroprotective after immediate application after traumatic brain injury in mild traumatic brain injury model. In the Y-MACE test, the number of entries was decreased in the trauma groups when compared to the control values, and this response was found to be compatible with the freezing responses observed during the experiment. So you see here, number of entries, it's the Y-MACE test, so it has three regions that the rat can move. So number of entries is decreased after trauma, and although there's a slight increase in the niacin, there was no statistical significance. In spontaneous alteration, we see that in the pre-control and post-control, there is a level, but it wasn't changed with the trauma or niacin in spontaneous alteration. So in the novel object recognition test, the discrimination and recognition indices were significantly decreased in the trauma group. You can see that it's statistically significant. And in the most of the treatment groups, values were close to the pre-control values. When we look at the tail suspension test score, the application of tail suspension test to evaluate corticospinal function demonstrated a significantly increased score after traumatic brain injury, and lower scores were obtained in the niacin treatment group. As we conclude, in this study, for the first time in the literature, niacin treatment after mild TBI showed ameliorated damage, and examining the effects of niacin on both pathophysiological and functional results in traumatic brain injury and obtaining promising results would shed light on future clinical studies. Thank you so much for listening.
Thank you so much, Dr. Pinar Kuru.
Thank you
for your informative speech. Yeah. Any questions you would like to ask, or any topic you would like to discuss? We are having a question for you in the chat box.
Sure, I can check. Let me just see. So is this question, is the mildest form of traumatic brain injury in the literature as defined by Ucher et al. Is the 300 gram from 1 meter. It is the mildest form of traumatic brain injury. And as we know from Glasgow Coma Scale, when we see the patient in the emergency department after traumatic brain injury, if the Glasgow Coma score is 15, it is the mildest form that we can evaluate. So there is no consciousness lost, there is no motor deficit. It is the mildest form of the traumatic brain injury. Yeah, right, sure.
Any other?